Boys love ravishing girls like daughters love grapes and nuts. The order of draw. Probably never heard of it, right? How many times have you gone to the doctor and had them draw countless amounts of blood out of your system with the number of tubes they use? However, I can assure you they are not drawing it out for no reason. What is the order of draw? The order of draw is the order in which phlebotomists collect specimens in a particular order to prevent cross-contamination. There can be up to 10 tubes in the order of draw, however, this varies from each medical institution you are located at. Each tube has its own additive, department, and test. The additive in the first tube, this one is sterile yellow. Its department is microbiology, the additive is SPS, and it mainly consists of just a blood culture test. The second tube in the order of draw is light blue. This one's additive is sodium citrate, and the department is coagulation, which it tests how fast your blood clots. The third tube in the order of draw is red, and this one has no additive. The mnemonic device of boys love ravishing girls like daughters love grapes and nuts will help you remember the correct order of draw. The first being sterile yellow or your blood culture tube, the second light blue, the third red, the fourth being tiger top. Sometimes this can be a gold top tube depending on each institution that you're at. Then we have light green, dark green, lavender, gray, and then navy. There are many ways in which a phlebotomist can draw blood out of your system through the order of draw. However, this varies depending on how fragile the patient's veins are. This can vary between using a syringe and an evacuated tube system. Many phlebotomists will use an evacuated tube system when there is a needle that goes into your vein and then there's a needle that is inserted into the top of the tube to allow the blood to immediately flow into the tube. However, with fragile veins, many phlebotomists will use a syringe, and this will allow them to draw the blood out and then attach it to an evacuated tube system that works exactly the same, that then transfers the blood into the vein or into the tube. The order of draw was established after an incident in 1977 when two doctors diagnosed a patient with hyperkalemia and hypercalcemia after an event of cross-contamination with the order of draw. Since then, the order of draw has been heavily assessed to allow patients to not be diagnosed with these diagnoses. The order of draw goes highly unnoticed by non-medical personnel, however, it is highly important for patients. So when a phlebotomist draws every ounce of blood out of your body, I can assure you they are doing it to protect you.